Hello everyone, I am Joshna from Geetanjali College of Pharmacy, currently in the second year Form D. Today I am here to discuss about the topic ocular rosacea. Ocular rosacea is an inflammatory disease that affects your eyes and the skin around them. It's a form of the broader skin disease rosacea that affects your whole face. It's also sometimes called meibomian gland dysfunction. In the short form, we can call it as MGD. Ocular rosacea is a chronic, means it prolongs for a long time, and this is the disease that has no cure. You can manage it with treatments and avoiding your triggers. And the next come to the contents, and the first one is overview, symptoms and causes, diagnosis, tests, management, treatment and prevention. Comes to the overview. In this overview we can see inflamed or swollen eyelids, dry, bloodshot eyes. And the next comes to the symptoms and causes. First of all, what are ocular rosacea symptoms? Symptoms of ocular rosacea include inflamed or swollen eyelids, means it's sometimes referred to as blepharitis, swelling around your eyes, discoloration or redness around your eyes, pink eye, conjunctivitis, bloodshot eyes, itching, burning, dry eyes, watery eyes, means access tears, crusty discharge in your eyelash, recurring styes or chalagia, sensitivity to light. And some more information about ocular rosacea regarding to symptoms, means it causes dry eyes, red eyes, blurry vision, fluctuations in vision, light sensitivity, burning or itchy eyes, history of frequent audioloma. Coming to the 20% of patients with ocular rosacea, 20% have signs before dermatologic findings. And coming to the 90% of patients with ocular rosacea, as many as 90% have only minimal skin changes. Who does ocular rosacea affect? Ocular rosacea can affect anyone. A few groups of people who are more likely to develop ocular rosacea that include adults between 30 and 50 age, women and people assigned female at birth, people with light or fair skin, people from Western European ethnic backgrounds, especially from England and Scotland. And how common is ocular rosacea is? Experts estimate that around 5% of people worldwide have some form of rosacea. However, many people with mild symptoms never have their rosacea. People tend to assume symptoms of ocular rosacea or issues like seasonal allergies or problems with their contact lenses. If you experience new symptoms, especially if they come back more than once, talk to your head care provider. In this, we can see ocular rosacea symptoms on skin of color. Rosacea is sometimes only associated with redness on white or fair skin, but people with darker skin and skin of color can get ocular rosacea too. Many of the symptoms are the same, but rosacea's trademark discoloration might be harder to notice on dark skin. It might not also show up at all. Symptoms of ocular rosacea on skin of color include a warm or hot feeling around your eyes, discoloration around your eyes that's a darker brown than your usual skin tone. Although no one knows for sure what causes rosacea, some circumstances and conditions are known to trigger it, including exposure to UV light like sunlight or tanning beds, stress, exposure to intense weather like heat, wind, or the cold, drinking alcohol, eating spicy foods. According to the content, and next is the diagnosis and test. How is ocular rosacea diagnosed? Your healthcare provider will diagnose ocular rosacea with a physical exam. Make sure you tell them about all symptoms you have felt, even if they get better before your appointment. Your symptoms, medical history, and whether you have noticed any triggers are the only way to diagnose ocular rosacea. So, every detail you share can help your provider diagnose your issues correctly. Instrument used for ocular rosacea is lipid scan. In this picture, we can see the lipid scan and the structure of the eye and its settlement in the instrument. In this, it contains pressure, eyelid gland, heat, eyelid. At last, we can determine the scan of the eye and we can know the stages of the eye and how it is affected by the rosacea. And this is the report which we have performed the scanning through the instrument called lipid scan. By these, we can know the stages of the rosacea. Next, coming to the content, management and treatment. How is ocular rosacea treated? The most important aspect of treating your ocular rosacea is knowing and avoiding your triggers. This is especially true because there is no cure for rosacea. Knowing what triggers your symptoms is the best way to avoid experiencing them. Other treatments include warm compressions on your eyes both during right after bathing, artificial tears or eye drops that contain lipids. Doxycycline, it is an antibiotic pill. Washing your eyes with pH balanced cleansers instead of just soap. Wearing sunscreen, and you always remember that always use SPF 30 or higher. And next, coming to the last content, prevention. How can I reduce my risk of ocular rosacea? After you have been diagnosed with ocular rosacea, the best way to reduce your risk of future flares is to know and avoid your triggers. Some of the best ways to prevent flares include limit your sun exposure, find ways to cope with stress in your life, get a healthy amount of sleep. Thank you guys for your attention.